Good morning, everybody. I am so delighted to welcome everybody to day two. This is going to be an invigorating conversation. Thank you so much for Emery and Yusuf for opening the day. And now I have the pleasure of introducing our beautiful panelists for the Health Meets Equity Design Thinking. So Author Edge is the leader and director of the Healthcare Innovation Special Interest Group at the National Society of Black Engineers. We are honored to have him today, as well as have NSBE as one of our core partners in this Hacking Racism initiative. Tricia Gunter is a mental health specialist and has her own private practice. Dr. Chinonye Egbulem is the Global Health Fellowship leader for the CDC. And then we have my amazing mentor, Jeff Hoffman, who is probably in Uganda somewhere helping babies right now, joining us today, founder of Priceline. And then Beatriz Cantada, who was the program director at MIT for Community and Equity Office. So thank you all so much for joining us today, and I would like to welcome you all on and turn it over to you.
Well, thank you so much, Angel. Hello, everyone. Author Edge here. Good morning, good afternoon, wherever you're joining from around the world. We're really excited for this panel, and I'm excited to moderate. As mentioned, I am with the National Society of Black Engineers and lead the Healthcare Innovation Special Interest Group. The overall mission of our organization is increasing the number of culturally responsible Black engineers who excel academically, succeed professionally, and positively impact the community. So I'm really excited to partner with MIT through NSBE and the Hacking Racism Summit and Black Tech Matters. So we have a big topic to cover, right? It's around healthcare, equity, design thinking. And so I want to jump right in with a little bit of background to set the stage. So we know that racism and inequity are products of design, right? We talk about this frequently, systemic racism. So if it's the product of a system, can it be redesigned? And can we do this in an equitable way? So what is equitable design or equity design and design thinking? It's an iterative, creative process to really dismantle these systems of oppression and redesign them or rebuild them and liberate the communities that have been historically impacted by the oppressive systems. So I want to move straight to introducing some of our speakers who are going to share a little bit about their thoughts on the topic. You heard about Tricia Gunter. She is an eclectic therapist, presenter, and consultant, and a mental health expert. And she served as a behavioral healthcare manager for a variety of organizations, but most interestingly, she's worked on interdisciplinary teams with physicians, nurses, social workers, administrators, lots of stakeholders to really help address behavioral health needs, utilizing partnerships between all the important subgroups. And this informs her position on this topic and really driving towards health equity design thinking. I'm going to pass the mic to you, and please let us know your thoughts on this topic.
Thank you, Arthur, for that introduction. So I would like to invite all of us to participate in an exercise in empathy. So empathy is the first step in design thinking. So I'm going to begin by asking you to empathize with me. I am a woman of color, and in my personal experience, my relationships within my network, and travels that I've done, I have experienced the African diaspora of which I'm a part, specifically in Africa, the Caribbean, and the Americas. Through that lens, I perceive that systems of race and racism present differently based on the history of slavery and emancipation in the different countries and contexts. In my opinion, The American brand of racism, unfortunately, is specifically brutal and dehumanizing. And some examples of this include the decimation of indigenous people, chattel slavery, hyper-capitalist exclusion from access to resources, and this current administration's narrative regarding immigrant groups. My primary work is as a therapist, and in that capacity, I'm often having very difficult conversation. Now, doing 1,000+ sessions per year, it gives me access to qualitative data. And it also allows me to see how that data changes over time with intervention. And among my many clients of color, what keeps popping up is a very complicated expectation to always be strong and resilient, somehow built for crisis, perpetually in crisis, conditioned for crisis. And in a context like that, it's very difficult to thrive. So in order to help cope with that, what we do is we build walls in an attempt to keep ourselves safe. The problem with walls is that when they are in front of you, they obstruct your vision. They prevent you from seeing clearly. And if you can't see clearly, you can't properly assess a problem. You can't properly assess the damage in order to make a plan to address it adequately. So I'm going to tell you a story about one of my clients. Well, it isn't really one client. It's a composite of many of my clients of color. And to be honest, it includes a little bit of my life. And perhaps with some reflection, you'll see that it probably includes a little bit of yours. So as a person of color, operating in a world, in a system, in a context in which they are constantly, perpetually, continually met with emotional, sexual, relational, family, occupational, environmental, economic, and resource and health trauma in the form of denial of access, difficulties gaining access, and gaps in even understanding and sometimes even appreciating the need for access to care in ways similar to what I have to contend with often, which is stigma around people of color receiving and reaching out for very much needed and beneficial mental health services. With all of those odds stacked against this client, this user, this patient, how is this person supposed to interact with even the most advanced and accessible healthcare system available to them? It's just too hard to engage from that individual level. And so I don't tell you this story for you to feel discouraged. I'm telling you this to encourage the hackers, the allies, and everyone participating in this process today and beyond to not only look at the macro changes that need to happen in terms of health equity and design thinking, but also to look at the micro, the individual, leverage behavioral economics, use nudges, insert into the culture and into individuals a consciousness about the social determinants of health in order to effectuate a paradigm shift that will help us break down those walls so we can see clearly that we need to focus on our own health and wellness, help bridge that gap between where we are and where we need to be regarding the care that we already have access to as we await a greater access to the healthcare that we need. So thank you for participating in this exercise with me, and I'm going to hand it back to Arthur.
Wow, Tricia, I'm actually trying to hold it together. That's a very personal, creative anecdote, but I think it really hones us into the notion that there is an individual, right, on the other side of all of our programs, initiatives, and supply chains. I want to encourage everybody to post questions in the Q&A. You can bring them in at any time. I see some people doing that, and we'll get to those very soon. But I want to move straight away to Chinonye Egbulem. She goes by Chichi. She is an accomplished gender specialist, social impact thought leader, and racial equity consultant. All of her advocacy work is centered around this aim, as well as economic empowerment and the use of mindfulness-based programs for post-traumatic healing. As a dynamic and bold disruptor, she encourages humanitarian and international development organizations to access their approaches to tackle issues of equity and inclusion in service to, right, the diverse communities we're talking about. Let us know what you think as we're digging deeper into this, Chichi. We can't hear you. Maybe let's check the sound.
Can you hear
Perfect.
me? Can you hear me now? Oh, okay, great. Thank you so much. Greetings, everyone. Good morning. I was saying thank you, Tricia, for that very powerful, powerful exercise. There's nothing like being able to step outside of our whatever privileges, space of privilege that we find ourselves in, and putting ourselves into another person's shoes and really working to see the angle in which that person's experience is being shaped by, whether it's through your built environment, what you have access to or what you don't have access to, etc. So I'll just briefly introduce myself. I am a public health social worker. I currently work for the CDC. I am, under normal circumstances, based in Kampala, Uganda, where I work at the US Embassy as a global health fellow, focusing on gender issues that truly impact primarily young women and young girls who are incessantly exposed to various forms of gender-based violence. And I want to state that when it comes to gender-based violence, these, what we refer to as adverse experiences of health, it's not just specific to where I currently work in Uganda. It's a global issue. And even here stateside, where I've done a fair amount of work, and especially in urban areas, you know, it's an issue that just spreads deep and it's very pervasive, and it's often manifested in the form of racism. And so when we talk about the ability to empathize, I'll start off by saying that I'm Nigerian American, and so for me, my lens is very much shaped by all of these. There's a duality to it. So, you know, growing up in an African household, it was very interesting to me because, you know, I grew up in a space where a lot of my ideologies, my thought processes, my beliefs were shaped by people who didn't necessarily grow up here, stateside in the US. And so that goes back to what we consider to be our perceived understandings of whatever it is, as Tricia so eloquently presented to us. She referred to it as social determinants of health. So when we think about the healthcare providers that are you know, whether it be it a pharmacist or a social worker or a medical doctor, it's important that we really think about, you know, the way in which our frameworks have been presented to us, our trainings, what we need to learn, what we need to unlearn, what we know, what we don't know. And so I hope that's all, it all goes back to design thinking. And so a lot of the work that I do actually focuses on just engaging in thought-provoking discussions that really challenge our ability to think about what it means either to be anti-racist, to be diverse, to be inclusive, what the way in which our shared vocabulary either include or exclude certain populations, and how we can go about really making sure that we are implementing initiatives that enable our stakeholders, our beneficiaries to feel as if they belong and as if there is a safe space of some sort. And so I'm excited to delve into this conversation of design thinking. And so thank you so much, Arthur, for leading this discussion, and I'm ready.
Awesome. I love the diversity of thought on the topic already. And I'm really keen to hear what Jeff has to say. Jeff Hoffman is a successful entrepreneur, proven CEO, worldwide motivational speaker. You might already be familiar with some of his work as a best-selling author, Hollywood film producer, producer of a Grammy-winning jazz album, also producer of an Emmy Award-winning television show. And in his career, he's most certainly been a serial entrepreneur and a successful CEO, most notably being a CEO and founder of Priceline, among many other accomplishments. Most recently, he is the chairman of the Global Enterprise Network, which works with entrepreneurs in over 180 countries. And he's also a founding board member of an organization called the Unreasonable Group. And so it's through these efforts that he supports organizations internationally on economic growth initiatives, but also specifically on entrepreneurship programs. And he dedicates a significant portion of his time mentoring other entrepreneurs, including minority-owned businesses. So diversity and inclusion is at the center of all of the work that he does. Jeff, please let us know, how can we succeed at this?
Sure, thank you very much, Arthur. But first I gotta give some love to Angel. They say, don't just talk about it, be about it. And so I gotta say, Angel, thank you for being about it. We're here because you put in a lot of work because you cared to try to make a difference and make something happen. So, you know, I'll always be here for you, but I just wanted to thank you and Arthur and everybody that's involved in this for giving us this chance to have this discussion. So, you know, our title was Design Thinking in Health Equity. And here's what I want to say, that the reason this is so important is that our system, so ours is health equity and healthcare today, healthcare was not at all designed by the users of healthcare at all. Healthcare was designed at the other end. And so many systems, so much of systemic racism comes from the fact that so much of what we use every day, from government to private enterprise, and so many systems were designed by people that are not the end user, that didn't grow up the way they did, that didn't understand them, that don't live there, and yet they're creating a system, quote, for everybody to use, and it's simply unusable. If you think about in healthcare, for example, I have had people that have told me that they have felt even the language filling out forms in healthcare is culturally and racially biased. The language is chosen, the way that when you're speaking with medical terms, we were involved in a whole study on the medical terms and whether they're even accessible to different people based on the way that they were brought up and where they were raised and what their background is. So the whole problem is the systems were designed by people that designed them for their own use, really, and not considering the audience that we're talking about today. There was no racial diversity in the design. Why is design thinking important? Why are we here today? Design thinking is the process of starting at the other end. Instead of a major corporation, and I'm just gonna be very real with you guys, instead of old white guys like me sitting up in some giant office saying, we'll design the system for everybody in the country to use, design thinking says, let's go to the other end. Let's go out to the users, the families, the people, and say, what do you need and how can we provide it to you? So in design thinking, we gather a diverse and inclusive group of people, the actual people in need of this, of healthcare in this case. We understand how they live, what they need, literally how they talk, how they access a healthcare system. And we allow that group of users to basically, that's where the empathy is so important, right? To say, here's how we need to be served and taken care of. And then the other part of design thinking that I love, which is why we use it so much, is that you design and prototype, right? So we at the other end, let us design. I guess my bottom line, Arthur, is this: let us, the people, design our own healthcare system. Health equity will happen when everybody that's on this call is involved in a conversation to say, how should it work, instead of being told how it's going to work, because that's the way it is today. We are told, here's healthcare, if you don't like it, too bad. And if you can't use it, oh well. That is not the answer. The answer is to reboot, to design from the street back in and say, this is what we need, this is how it has to work. We prototype that. And that's the cool part about design thinking, is that you prototype stuff, it doesn't quite work, you fix it and you do it again. It's an iterative process of having empathy, involving the end user, the families and the people that need the service and letting them be involved in the design. Right now is a perfect moment in history for us to redesign many things. COVID forced us to realize how many things in our country don't work, from education to the workforce to obviously our healthcare system. Now is the chance, especially with technology like we're using right now. When have we ever had a chance for all of us to be on the same call together? We didn't used to do this. So now we suddenly have the chance to take the collective intelligence of everybody that's literally on this call, on this Hacking Racism conference today. So let's all put our heads together. Let's just design it ourselves. Let's build the prototype, and we'll create the future of healthcare, not be told how it's going to be. So that's what I'm excited about. We got to take action. We actually have to be about it after this call, not just talk about it today. Thank you for giving me a chance to say a few words, Arthur.
No, thanks, Jeff. I love the show me attitude. We'll have Beatriz briefly round us out, and I am dying to get to questions because they are flowing in on the chat. Beatriz, as mentioned, is a program director with the Institute Community and Equity Officer, and serves as and that organization serves as a thought leader on the subjects of community equity and inclusion and diversity within MIT, helping to drive activities as well as conversations and help people to be practitioners. We'd love to hear you round us out briefly, and let's have a discussion.
Thank you so much, Arthur. My name is Beatriz or Beatriz Cantada. I use the she, her pronoun series. Yes, I'm the program director at Institute Community and Equity Office. I will also be upfront. In the beginning, I was very hesitant to be part of this panel because of the big words, health, equity, design. And I'm like, what do I know about health, equity, design? And I realized upon further reflection that the work I do, diversity, equity, and inclusion, it's embedded in everything, or we can seek to embed it in everything. And I don't necessarily need to know the nitty-gritty details of the design, etc. So I appreciate Emory and all the other organizers for inviting me. And I do resonate and share all the sentiments from Ms. Gunter, Ms. Chinonye, and Mr. Jeff Hoffman in this panel too. Everything they said, I definitely agree and affirm, but there are a few things that also came to me as you begin this hackathon is, number one, as we're thinking about the framework and bringing people in, those who are impacted by the decision, I also want to remind our hackers or designers that part of the work is also you doing your self-work, you doing that self-reflection in terms of, what were your biases? How do you define health? Because how you define health might be very different than the person that you are designing this framework for. So I think that's a first part, is really empathy, very important, but starting off with how are you contributing to this design? Because you're bringing your own cultural awareness, social identities, and I say plural, and I also want to reflect on your intersectionalities as well of these identities as you begin to create and design this framework. And the other piece I do want to remind you is pause. What does pause mean? So typically biases come up. They can disrupt the process when you don't allow yourself time to reflect. So what that means is every step along the way as you design this, pause. Think about, okay, whose voices are missing? Who did we miss out on listening to what the needs are? And that, I mean, is every step of the process. And then once you have the final product and maybe you implement it, go back again and ask that question. What did we miss? What worked well? And I appreciate what Arthur had said about it being a creative process. So what that means is it's constantly also evolving. So you may create this design, but also know in the back of your head that this will constantly change based on the evolving needs of the communities that you are serving. And I think that's it, like what I want to share. Again, this is such an important work that we're doing here. I appreciate all of you as you reflect and use all your skills and abilities to make the world a more equitable place. Enjoy the hackathon.
Thank you, Beatriz. So the questions coming in are not softball questions by any means. So, you know, we're going to tackle these and field them in tag team, but come to a collective understanding. So the first one I want to ask and address, you know, the elephant in the room, right? Building trust is key in communities comprised of Black, Brown, Latino, Indigenous people. So what can we do from the perspective of empathy, right, to identify harm that's been done, acknowledge that harm, or determine if that harm has been resolved, right? Looking at empathy and like defining the problem. And I will, you know, I won't volunteer anybody, but anybody who wants to jump in, you know, feel free to share.
So I think one way that that could be dealt with is through like a compensatory model, basically looking at what is lacking. So a playing field is not actually level if somebody is shot in the foot, if we're all trying to get to the same destination. And so I think really addressing gaps, addressing things that have been taken away from a certain group or omitted from a certain group, contrary to a lot of people's perspective, I actually don't fully agree that advantages in some groups need to be taken away. I think they just need to be compensated with advantages for the disadvantaged group so that it becomes a win-win situation as opposed to a zero-sum game, which some people tend to feel like the answer to racism is a opposite or reversed racism. So that's sort of my take on that question.
You know, you make a really good point when you said sometimes it winds up in reverse racism because that people don't talk about very much, but that does not help us with empathy, right? Empathy actually goes both directions. So I agree with you. I'm just glad you pointed that out because there's no solution if we're not all in this together. If everybody is to sit at one table and work together towards the same goal, we're not going to get there. So I'm glad you pointed that out, that empathy, again, is a two-sided thing, and everybody's got to meet in the middle.
So I also want to tie in some questions from the chat, but also on the same theme. As we think about MIT, you know, is a hackathon enough, right? Is that going to help us change the equation? You know, what are your thoughts, maybe, Beatriz, about that?
Thank you, Arthur. So here's what's happening right now. What we're doing is not working. When I say we, is what are the actions or what are the steps that MIT has as part of culture that is not working to address this? So what that means for me is it's part of our culture to do hackathons. So I'm not saying stop doing hackathons, but how do we think outside the box? Like, how do we shake it up a bit where we do hackathons, but then what does that mean? Where's the accountability? How do we go back to it? Is it a one and done deal? How are we committing to making this new framework accessible to all, widely spread? So again, how do we work with what the culture is currently and how do we shift it? Whether it's eliminating it altogether or expanding it. So those are things we have to think differently, not always the same way, the same process, because if we did the same thing, we wouldn't be in this situation. And when I say we, it's not just MIT, but society. So really innovation is so important. So let's leverage the culture that we have, but let's also know that if we do the same thing over and over again, we're not going to get the results that we want.
So building upon this conversation, you know, another question, I guess very frankly and transparently, right? Do you think we can dismantle racism, right? And if so, once dismantled, how do we rebuild with the right people at the table? Like, what are the practical actions that we can take when we think about, right, racism in the healthcare system.
I'm happy to share my 2 cents. So I think that as it relates to design thinking, we really have to take 2 steps back and think about power shifts and where there are power imbalances. And so a lot of the work that I do, especially through my consulting practice, you know, I partner with organizations, and whether we're talking about MIT or various healthcare systems, I think first we have to think about how we can go about helping, and Beatriz may have more to offer as a DEI specialist, but how we can go about helping organizations to truly unlock their potential by navigating the challenges that are oftentimes so deeply connected to equity, bias, diversity, inclusion, anti-oppression, anti-racism, etc. And so first we have to take it 2 steps back and think about how we as leaders, as stakeholders, as funders, how we design spaces for people to be able to contribute or not have access to contribute, and how we break down. First, we have to break down structural barriers before we can even begin to have a conversation about how we're going to break down or dismantle racism within the healthcare system, because we can't even get to that place until we address our own, as Beatriz mentioned earlier, biases. So, yeah.
Anyone want to add?
My honest opinion is I don't think we will ever fully end systemic racism, but we can certainly make changes, small changes or even big changes that actually will reshape that. And the reason why I say we won't end racism, because it's a system. It's a system that can be overwhelming, but then if you break it down into smaller pieces, whether it's within your work group, within your unit, department, organization, and again, this is again building off each other, then it is possible. But to actually say that we will end it for the entire world, that's not a reality. And I think if we tell ourselves not to expect that, then I think we can make more changes, because it's such a daunting vision or a daunting goal. But if we say we're going to work towards it, we're going to make the changes we can within our control, and we know we're going to make an impact. And if you leave it at that, people can find hope in that, right? That it's not like this something, a nebulous thought, but it's actually, we can do it in bits and pieces in our own local networks, communities.
Hey, Arthur, I want to jump in there too.
Go for it.
I just want to say 2 things. First of all, and following on what Beatriz just said, one of my all-time favorite quotes came from Mother Teresa, who said, if you can't feed 100 people, feed 1. And so when people ask giant questions like, how do we totally eliminate racism? There's no reason even starting there. What you need to do is go fix something, right? And we're not going to have one giant global program that's going to make everything okay. But if you start chipping away and everybody on this call do something in the community you live in, little by little change starts. So I think that's my first part is don't focus on a giant global problem yet. Go change something. Let's start somewhere and show and lead by example by fixing something so people look and say, wow, we actually can make progress. The other thing, just want to quickly share with you guys my personal opinion, but my answer to the question of the question was, and Beatriz said, the question was, how can we ever really wipe out racism? And I think Beatriz was saying not really, right? Can you nod either way? Beatriz, is that? Entire system, correct, yes. So here is my personal answer to that, is that I agree with her. There are generations of people whose minds we are not going to change. Look in the streets of America right now. It's just filled with idiots of every race and color. And a lot of them we're not going to change. So Again, editorial opinion, these views may not reflect the views of management, whatever. We got to focus on the youth. We have to raise a generation of young people who don't even start behaving like that, who don't even think that that behavior is acceptable, and who start by believing that diversity and inclusion is what makes the world around them better. Kids aren't born this way, I don't think. If you watch kids play, they don't judge what the other kids look like. Later, somebody seems to have taught them to start judging other people. But I actually did an experiment once to prove this. As I was traveling all over Africa, all over the world, we do business in 180 countries now. I just did an experiment. I brought a soccer ball with me to all these different countries. And wherever I was, I just threw it into the street and stood back. And you know what happened? Kids of every single color came out and a soccer game ensued. And I thought, nobody seems to be judging each other. So somewhere along the way, that is a learned process. So again, I think that focusing a lot, I spend a lot of time in schools now because I don't think we can change a lot of people that are out there now. And we spend a lot of time and energy that we're wasting on them, but we can put a lot more effort into making sure that this next generation does not grow up the way that all the rest of us did.
Oh, thanks, Jeff. We're getting a couple of questions in the chat to specific folks on the panel, and there are a few for Tricia, and I want to aggregate some of them and maybe rephrase. So I hope to capture everyone's intent from the individual questions. So we're talking about maybe we can't eliminate racism everywhere, but how do we ensure that while we're hacking the system and moving forward, that we don't create another inequitable system or product or service, technology, maybe it's a marketing campaign. How do we not, recreate something we're trying to eliminate? And then also, how do we continue to think about the individual, those micro level nuances that might, trigger folks or block them from considering or viewing, the services or products and technologies that we create?
Okay, thank you for that. And so basically my response to that is really back to that foot that has been shot in this proverbial level playing field. Let's treat the foot. Let's do therapy on the foot. We don't have to prevent the other players from doing what they're doing. We need to treat the foot. And that being said, finding ways to insert into communities the things that are needed to treat the foot. Some of those things could include health screening technologies in underserved community settings where people are at anyway, so they don't have to go to the doctor or to the clinic. The clinic will go to them. On a bigger level, quality reviews for less than optimal outcomes in underserved communities. The Centers for Medicare and Medicaid are transitioning to a value-based payment model that basically allows for that to be addressed. How are populations actually being served? Is the foot being treated, or are you going to keep billing with a bleeding foot and saying that it's a level playing field? And so I think basically using data, qualitative and quantitative data, to look at, there's research all over about ways in which communities of color are shot in the foot. Once you are addressing those issues in what you are building, then you are properly using empathy in order to design a better healthcare system that's more equitable. Does that answer the question? You can rephrase it if I didn't answer it.
No, I thought that was a great answer. Did anyone want to challenge that thought?
Challenge, just further add. Thank you, Tricia. I would say that for me, so in deciding to pursue a dual master's degree in public health and in social work, a big part of that decision came from the fact that you know, I had been working in various healthcare institutions, from shock trauma units, tertiary level institutions, to urgent care facilities, to group homes, etc. And for me, I realized that a lot of the systems that were being used were so reactive. It was like, okay, after not only the foot had been shot, but so many other issues, comorbidities kind of evolved or came out of being in a space where, you know, we didn't have that level, or not we, but, you know, my clients didn't have that same level playing field. And so when we think about the various socioeconomic factors that also contribute to the development of a lot of healthcare issues, from housing to food to education, and how these spaces have overall a much larger impact on the overall health of our communities, as well as the health of the individuals, I think we have to start there. And it's not just about being participatory and saying like, hey guys, we need a few leaders from the community to come in and partake in this process of working to address some of these challenges. Once again, I'm going to reiterate the need to break down power imbalances, because in reaching out to these people and saying, hey, we have this table and we want you guys to come and sit at our table and tell us how we can address your needs, it just inherently, how is that even going to work? Especially when there is a lot of diversity in the various, you know, America is just so, we're full of diversity, we're rich. And so I think that we have to think about how we can use technology to just give people the power, give the people the power. And I know that that sounds very scary. And oftentimes that's not, you know, even when I think about it, for me, it's hard. Like as a leader, I'm like, no, like, and sometimes I have to catch myself and unlearn and say, oh, hey, like I'm not the master, you know, like I'm gonna come to the table, and even the folks that I'm working with or working to, you know, even if they've reached out to me and they're like, okay, well, you know, we want your help, also getting them to realize, hey, like I'm not looking at you as lesser than, and even if I have resources that you can connect with and tap into, you have just as much power as I do. And that power just looks a little different. So once again, just awareness building and changing our thought processes.
No, thanks for that, Chi-Chi. If you're feeling scared and uncomfortable, that's probably how we should feel attacking these challenges. I'm still pulling things from the chat and want to integrate a couple of things to this next question for Jeff, and Beatriz may have the best insights. So many solutions to disparities are created by people from the community impacted by those disparities, potentially people of color. And access to funding is often a challenge for those groups of people, but it's also a challenge for any individual trying to develop solutions that impact people of color. So when you think about hacking racism, you know, how can we be successful when with that challenge for doing the prototyping and testing, or then moving from that to scaling to achieve the desired impact? And I want to circle back on making it even a more complex question. Jeff, you mentioned the concept of reverse racism earlier. If you have some thoughts about, right, tying in, qualifying what that means, while also providing needed solutions for funding to these types of challenges.
Okay, Beatriz, do you want to answer first though, the broader question? You can go ahead and then I'll reply to that.
So I will answer to the broader question, but also very unique to MIT. So when I think about, yes, we have all these great ideas and how do we get funding? So one of the things that I highly recommend is really partnering with your alumni association. And why do I say this is because in the past few months, I have to say the MIT alumni, they have stepped up. They have stepped up and said, how can we help? We want to help. We want to make changes. We want to be that pioneer institution that actually makes changes and solves problems. Like, I want to leverage that. I encourage folks to leverage that energy that's coming from the alumni, because they are so committed to making sure MIT is an anti-racist institution. So now that's very specific to higher education, though for other industries, I think in terms of funding, it's not a one and done deal. What that means is it's relationship building at every single moment of your life. What that means is you are constantly, when you're interacting with people, networking, etc., you are representing whether your product, you're representing your institution, your company, and you're telling them what you're doing. So you're already planting seeds in your networks. They may not be the ones funding it, but they will share that with other people in their networks. And guess what? You might be in Shark Tank. I'm just saying, for example, think about sort of when you start shouting it out to the universe, who's really hearing it? So I say that, you know, if you have an event, yes, of course you need sponsors, etc. But this is an ongoing relationship building that you're doing throughout the year, because that's where you're going to get your funding. That's where people are going to start hearing and see, wow, I want to support this group. I want to support this framework. They're doing good stuff. Again, it's not really directly answering it, but for me, it's the relationship building. And if you have access to your alumni, build that relationship with them.
All right, I will jump in and address that. First of all, three things that I want to cover here. First of all, the question about, you know, is funding harder to get for people of color and other minority and underserved communities? And the answer is absolutely. I'll give you a quick example. During COVID, the government made available the PPP program, which are loans to small businesses to keep small business owners alive. Once we got the data, I will tell you what the data said. Excuse me. Black-owned businesses, the 90% of the Black-owned businesses that applied for that funding did not get it. 91% of Latino-owned businesses in this country that applied for that business did not get it. And I think it's at 88% of female-owned businesses. So if you are a Black female or Latino female, that would made it even worse statistically. That's real data. And just a quick side note, though, in case we can help anybody, we actually launched our own grant program. We've been giving out $10,000 cash to female-owned, Black-owned, and Latino-owned businesses. The we is my organization, Jen. If you've seen it on TV or anything, my business partner, Pitbull, the singer, is doing this with me. But if anybody needs help, go to covid19businesscenter.com, and we are focusing on getting cash, not loans, not government money, our money, into the hands of Black, Latino, and women-owned businesses, as well as LGBTQ businesses, since the government's not doing that. But anyway, funding follows results. So you need to focus on outcomes. You can talk all you want, but funding follows outcomes. So you need to be able to show whose lives are going to be made better, and how are you going to collect data, and how are you going to measure that. Funding is harder to get, there's no doubt, but it's even harder if you can't show outcomes. We are seeing people get funded of every different color, gender, race, when they're actually generating an outcome. So that's what you really need to focus on in terms of getting funding. And the last piece that Arthur asked me specifically about in terms of reverse racism, there are some groups that are saying, because we feel excluded from the design process, right, of healthcare, whatever else it is. It wasn't designed for people of color or people of a certain economic level. That's all very, very true. But sometimes I see that people are forming design groups and hackathons of only those people, right? And so that's what I meant. I don't really know, I don't really like that word reverse racism per se, but I see sometimes people are doing the same at the other end. They're saying, we'll just get a group of people that look like us to address this issue because the people at the other end only designed it with a group of people that look like them. And I'm just saying, I don't think that's the answer. The answer is still to form diverse and inclusive groups. I'm going to give you a really quick example. We created something in South Central LA in Watts called the Watts Community Council. And if anybody ever drives by there now, you'll see that we're ripping out those old gang-infested complexes like Imperial Gardens, and we're building family housing there. But that is composed of a community council of moms and dads and local government and construction workers and young people of every gender, race, and color. We're all in this together. I personally go into Watts to sit on these council meetings because we all have to solve the problem together. So that's all I meant by reverse racism, is let's make sure that everybody's being inclusive. We're complaining about the system not being inclusive. Let's make sure we also are inclusive when we are doing hackathons. And again, I'm thrilled to be here at this MIT hackathon. Beatriz, I judge the MIT Enterprise Forum events all over the world because it's an inclusive audience.
Oh, thank you, and thanks for the clarification. We are fastly approaching like the end of the panel, so I want to try and squeeze in one more question and then allow us to share any final thoughts. And this is building upon a number of questions coming into the chat about the complexity of the system. So maybe I'll make up an example scenario. So, right, if you're a hacker in the hackathon, you might see that in your community or in a community, 15% of the population has a certain disease. And so now you're coming up with an initiative for that. But there are so many stakeholders to work with. You might first think, right, the patients or particular members of the community, or even the caregivers who work with those individuals. But you probably need a healthcare assessment expert, an epidemiologist. You need somebody who knows how to do health surveillance, community outreach people, volunteers to help you with your initiative, not to mention the nurses, doctors, clinic administrators, representatives from local businesses, whether it's a pharmacy, a rec facility, right? These social determinants of health, the homeless shelters, the food pantries. I mean, the list goes on, right? The local school administrators. And we already touched on kind of one piece, right? Somebody to fund all of this, plus maybe even church leaders. That can feel daunting. Just like, how do I start? And how do I, bite the elephant, right? Or eat the elephant one bite at a time. Many hackers going into the hackathon might come against this challenge of complexity. What's your thought on that piece?
I spoke last, so it's
a real
not my
tough
turn.
Question.
Who didn't speak last? Let's make sure we're all getting equal time.
So maybe I know a lot to unpack. When you think about your work or starting a new initiative, who are the first people you reach out to, knowing that ultimately there might be 10 or 15 or 20 stakeholders to address a challenge?
I would say that the closer you get to the individual, the better. I think that it needs to start from the individual and build out. So that would look like the number one being the individual you're trying to serve, then their caregivers, then their providers that are providing them services, then their communities, then the governments that are local to them, then the broader government, because we are in a system that is supposed to be a democracy. And in this democracy, it's not truly a democracy if people are not informed and empowered. And so the people who need to be informed and empowered are the individuals. So I think it still goes back to that empathy piece. Now, how you do that could be a myriad of different ways. That's what the hackathon is all about. But basically, I think the focus needs to be getting as close to the individual as possible and building out from there.
Cool, thank you.
I have a So I agree with Ms. Gunter, but I also have a slightly different approach, and I'm going to share it from an MIT perspective on how things get done here. So if we're going to have an initiative and we're trying to see, okay, is this going to be effective? We always are looking for consensus building. So we start thinking about the different constituents across campus. So I'll give you a simple: undergraduates, graduate students, postdocs, staff, faculty, research scientists, scholars, alumni, and other community members. So we look at it from, okay, what are the different constituents that make up this community? And for example, that's MIT. Then we start thinking about the different social identities that we have on campus, and how is it reflected in the different constituents as well. And then also thinking about, again, the concept of intersectionality. Are we able to manage that and bring them into the fold? So I definitely agree. We want to know that the end user, we need to get that, is this going to work? And at the same time too, we need to get buy-in from the folks that actually are change agents, the ones that can change policies. So it's really a complex approach, because you want that model to work for the end user, but those that have access to money, those that have influence, those that have power, they also need to be included in the conversation. So again, it's complex, and it takes time, and that's okay. I'd rather that you take time, be deliberate, be thoughtful, because then your end product will be beneficial, if not to all, to many people.
I appreciate it. I want to move to very, very quickly, folks, final thoughts or comments, practical advice as the individuals who embark upon the hackathon are committing to something that's an important challenge and, won't change overnight. So if you have, maybe in your 30 seconds, your final practical advice, but also if you'd love to share or like to share ways that people can stay in touch with you or follow you, please share that as well.
Sure. I'd like to first start off by saying thank you so much, Angel. As Jeff mentioned earlier, this wouldn't be possible without you and the co-creators that are really paving the way for an initiative that is necessary. I want to also highlight the fact, because we've been sitting here in this space and we've been talking from the lens of being practitioners, and as someone who is a serial social entrepreneur and who has participated in and attended many boot camps, business boot camps, as well as accelerator programs, when we think about business development, or if we're talking about design thinking and designing a product and the end users, I think I want to encourage you all to also think about who it is that can help you to achieve your goal when it comes to the design of the actual product that you're making. That is huge. And so I am not the expert. I do have a lot of experience just from working with various AI scientists, but there are resources out there, and I'm happy to share more. Feel free to reach out to me on Instagram, well, across all social media platforms. You can find me at Afropreneur Chi, and feel free to email me, etc. Thank you.
Tricia, would you like to share, or Beatriz or Jeff, how people can stay in touch, or final thought?
Yeah, so my final thoughts are, please, please, please educate yourself, or just stay well versed on the social determinants of health. You can find that at the cdc.gov/social determinants. That's it. Just look it up. Make sure that you are addressing that foot. That foot is bleeding all over this track. And if you address the foot, then we can get toward health equity. If you would like to further any discussion with me, you can reach me at LinkedIn, Tricia Gunter, MA, LMHC, LPC.
What I'll share with you, and I said it in the beginning, One thing I do want you to remember is to pause. Every step of the way, pause. Stop and ask yourselves, are we being inclusive? Whose voice are we missing? Who will be impacted by this part of the process? And always center everything with the human being. You're doing system designs, you're probably gonna do technical words I may not even understand, but remember, center on the human being. And the best way to reach me, you can email me at bcantada@mit.edu. I also am in LinkedIn, and I just updated my LinkedIn profile in preparation for this.
All right, again, I just want to say thanks for everybody for being here, and thank you for the organizers for making this possible. And I think I'll just close with something I said earlier, that this is a huge problem. So don't worry about that. Do something. Focus on something that you can do where you live, where you are, with your skill set, with your passion and your relationships. Every one of us can help chip away at a big problem by doing something instead of being scared because the problem's so big. And our organization, Global Entrepreneurship Network, GEN, is genglobal.org, or you can reach me directly. My email is just jeff@jeffhoffman.com. Thank you.
Well, thank you everybody for listening in. I've also put my contact information in the chat. Again, Arthur Edge. And we are just really excited for everyone on the call, everyone who engaged in the conversation with questions. Please take these forward through the rest of the day and look forward to seeing you in the hackathon in mid-October. I will hand the program back over to Angel.